I'm Dr. Young, and I'm a pediatric otolaryngologist here in Des Moines, Iowa.
My name is Courtney. I am the Child Life Specialist at Iowa ENT Center.
Since we've been using virtual reality now for 5 months or so, we've noticed some interesting changes in how we interact with patients.
We've been using it frequently, and the results have really been outstanding.
Historically, we've been able to use some classic child life techniques, distraction therapy, play therapy to get through and to overcome some of the challenges of trying to treat a child. With VR, we are able to go the next step.
Joel has to go to the doctor a lot. He likes to know what's going to happen, and sometimes he gets a little nervous. Okay, are they going to stick me with something this time? So that's the great thing about this, is it distracts him from it, so he doesn't even have to worry about it.
I think I'm inside of the brain.
You are?
What does the brain look like?
It has a bunch of these black,
Nice job.
yellow and orange and red kind of stuff.
He's really into visual things. He actually enjoys coming here just because he knows he's going to get hooked up on the virtual reality.
So we saw a really big difference from the first time that we had Joel in for an appointment as compared to when he came in and had virtual reality.
You have to be in very close proximity with odd-looking instruments. If the child doesn't have to see any of the instruments whatsoever prior to the procedure, nasal procedure, ear procedure, foreign body extraction, you take away 90% of the problem. Cleaning of the ear without anyone really noticing. The procedure takes a moment, but getting there sometimes takes a physician 10 minutes to try to address their anxiety, get through it, work beyond it, and get the procedure done. I'm gonna look in your ear this time, okay? What do you see?
I'm in this weird place with a bunch of kind of maze kind of thing.
We introduced the virtual reality goggles, and he really loved the experience. He let Dr. Young do everything to him without any kind of complaint or even really knowing what was going on.
So what did you think of all the things I just did? When I looked up your nose or cleaned your ears, did it bother you at all?
Nope.
I think in the future, we would really like to use virtual reality with adult patients who are doing in-office procedures.
I'm trying to convince my colleagues that they could use it in the office for adults for their nasal procedures as well. I think it's perfectly geared. It does not have to be only for children.
We would also like to use virtual reality in the surgical setting, so during IV insertion for kids and also during anesthesia induction.
If you find the right patient, if you find the right procedure, you're able to do things that you really shouldn't be able to do in an outpatient setting.
And my favorite thing is when kids put on the goggles for the first time. A lot of them have that,